John suffers from a sore throat and a dry cough. His twin brother James suffers from chest pain after eating. That's why they both use the antibiotic Co-amoxiclav. It takes effect within hours and solves their problems. For instant relief of all your medical problems, the antibiotic Co-amoxiclav. Stop! Obviously, this medical advert is a joke. John is suffering from the flu, which got better because of the paracetamol he was taking. His twin brother James was suffering from heartburn, which got better because of the Gaviscon he was taking. The Co-amoxiclav was a placebo prescription that the doctor thought had cured them. Antibiotics, especially Co-amoxiclav, is prescribed too often and too easily in hospital. So with that in mind, here's a 5-step approach to prescribing antibiotics. Number 1. Is it sepsis or bacterial infection? Not all fevers and presentations are bacterial. It could be viral. Check. Is the patient clinically unwell, not just a high mu score? Have they got raised inflammatory markers, the raised PCT? Or do they have signs and symptoms of a focal sore? A raised CRP could be due to other reasons such as a fracture, soft tissue injury, constipation, malignancy, viral, etc. Number 2. Look for the source of the infection. Focus on the primary presenting complaint, look at any imaging or cultures available, and look at associated risk factors or previous infections. If you know the focal source, then give the antibiotic that targets it, such as chest, urine, or cellulitis. If you don't, then give a broad antibiotic. Number 3 is cultures. Always send off cultures when prescribing antibiotics, and always review recent and previous cultures before prescribing the antibiotic. If a recent urine culture shows E. coli, or recent sputum culture shows Klebsiella, which is resistant to Co-amox but sensitive to cotrimoxazole, you're not going to prescribe the Co-amox. Fourthly, and very importantly, look at the side effect profile of the antibiotics. Obtain help from a pharmacist or the BNF. Now here are common side effects of commonly prescribed antibiotics. Co-amoxiclav, which has a high C. diff risk, diarrhea, deranged LTs with a cholestatic picture, gentamicin, which is notorious for its nephrotoxicity, and ciprofloxacin or moxifloxacin, which also has a high C. diff risk, lowers the seizure threshold, and can cause tendon issues. Number 5. Review the antibiotic after you've prescribed it over the following days. Plus minus discuss with a microbiologist. Can the antibiotic be stepped down to oral? If the patient is not improving or getting worse on the antibiotic that you have prescribed, do they need escalation in the antibiotic? Or is the antibiotic resistant to what you're treating, or you're treating the wrong focal source? So always check on a daily basis. So remember the 3 C's. Co-amoxiclav is not candy. Co-amoxiclav has complications, and Co-amoxiclav requires careful consideration. So happy prescribing, every doctor. And if you enjoyed this video, don't forget to subscribe.